Hi friends, today we start with NEET PG MCQs. Today's first question is, a patient hailing from Delhi presents with fever, arthralgia and extensive petechiae rashes for 3 days. So they are giving the location that is from Delhi. So it may be a something localized disease. Then we see lab investigations received a hemoglobin of 9 gram per deciliter. Okay, HB is low. A WBC count 9,000 cells per mm cube. Platelet count 20,000 cells per mm cube, and prolonged bleeding time. See, bleeding time is prolonged. Maybe some bleeding disorder, or let us see what are the options. Clotting time is normal. What is the most likely diagnosis? Options are malaria, typhoid, dengue, scrub typhus. So whenever there is a bleeding time is increased, so we suspect something like dengue. Dengue, this is an acute onset high fever, severe arthralgia, that is breakbone fever. It's called as breakbone fever, and a prominent petechial rash that is coupled with severe isolated thrombocytopenia in an endemic zone like Delhi. Delhi is strongly endemic, and it is a pinpoint of today's first question. Next question, let's go to the next question. Which of the following statements is true about Trichomonas vaginalis? So the options are, so Trichomonas vaginalis, option A, twitching motility is seen on wet saline mount. So wet saline mount, इसके ऊपर हमें twitching motility दिखता है. Option B, cysts are seen on wet saline mount of vaginal secretions. Cysts, ये cyst कहाँ बनाता है? ये Trichomonas vaginalis ये cyst नहीं बनाता है. It cannot be cultured. अरे कल्चर कर सकते हैं हम, Trichomonas vaginalis कल्चर कर सकते हैं. It is not a sexually transmitted infection. Of course, it is a sexually transmitted infection. So true, they are asking about true. So true is twitching motility is seen on wet saline mount. Yes, that is right. A fresh saline wet mount of vaginal urethral discharge. It allows for the direct visualization of the live flagellated protozoan displaying its classic jerky twitching movement. So it is a classic jerky twitching movement that exhibits. So next question is, third question, a lady from the West Rajasthan, again it is an endemic disease, it may be, a lady from West Rajasthan presented with an ulcer surrounded by erythema on the right leg. Ulcer surrounded by erythema on the right leg. Microscopy of the biopsy from the edge of the ulcer showed organisms with dark staining nuclei and kinetoplast. What is the most likely causative agent? So हमें causative agent ढूंढना है. Options are A, trypanosoma, B, babesia, C, leishmania tropica, and histoplasma. So since it is an endemic disease, okay, so this I will go with leishmania tropica. So biopsy findings show intracellular amastigote forms. तो biopsy में क्या दिखता है हमें? Intracellular cell के अंदर जो है intracellular amastigote forms of Leishman Donovan bodies देखने को मिलता है, containing a distinct nuclei and rod-shaped kinetoplast. डिस्टिंक्ट न्यूक्लियस भी मिलता है, रॉड शेप काइनेटोप्लास्ट भी हमें देखने को मिलता है, which is diagnostic of cutaneous leishmaniasis endemic to dry regions of Rajasthan. Next question, fourth one, a child presents with fever and a rash. Children है, fever and rash है. Urine examination showed cells with owl's eye appearance. हाँ, this is the point here. Owl's eye appearance. What is the most likely diagnosis? Owl's eye कहाँ मिलता है हमें? साइटोमेगालोवायरस में मिलता है क्या? एप्स्टेन-बार वायरस, टॉक्सोप्लाज्मा गोंडी, हर्पिस सिम्प्लेक्स वायरस. सो साइटोमेगालोवायरस, सो मेगालो बड़ा, साइटोमेगालोवायरस बड़ा. साइटोमेगालोवायरस में हमें enlarged epithelial cells that shed into body fluids or urine that show a large dense basophilic intranuclear inclusion separated from the nuclear membrane by a clear halo create a pathognomonic of owl's eye cytopathology. Owl's eye cytopathology. तो owls का eye जो रहता है ऐसे दिखता है, दो बड़े बड़े आंखें जो रहता है ना वैसे दिखता है ये cytomegalovirus. Okay, next question. Fifth one, infection with Clonorchis sinensis. So next question is Clonorchis sinensis. It is associated with an increased risk of. So Clonorchis sinensis, that is the clue. It is gastric carcinoma, cholangiocarcinoma, cervical cancer, and bladder cancer. Options. These are the four options. Okay, gastric carcinoma, we know it is very famous, H. pylori, that causes gastric carcinoma. Cholangiocarcinoma, keep it aside. Cervical cancer, HPV infection, We know bladder carcinoma, colonoscopy sinensis. I'll go with cholangiocarcinoma, chronic long-standing infection of the biliary duct by the Chinese liver fluke. Yes, so Chinese liver fluke. Colonoscopy sinensis इसका दूसरा नाम है Chinese liver fluke. It leads to severe localized mechanical and chemical epithelial hyperplasia, which is strongly associated with adenocarcinoma of the bile duct. Bile duct जो रहता है वहां पे adenocarcinoma हो जाता है. Chronic long-standing infection of the biliary duct with Chinese liver fluke. Okay, next question. Sixth question. A patient presented with the complaints of persistent cough. Okay, persistent cough, something chest infection, and weight loss. Okay, weight loss is there. He had a history of contact with multiple sexual partners. He was diagnosed as HIV positive 6 months back and is poorly adherent to his medications. अच्छा, medication नहीं लिया. The fungal culture of sputum was negative. Fungal culture sputum is negative on Gomori methamine silver GMS stain. Gomori methamine silver, that is GMS stain. Cells showed darkly stained crescent shaped cyst. Achha. Darkly stained crescent shaped cysts are there. What is the most likely causative organism? So options are Coccidioides immitis, Paracoccidioides brasiliensis, Histoplasma capsulatum, Pneumocystis jirovecii. Pneumocystis jirovecii. So the answer is Pneumocystis jirovecii. This opportunistic pathogen, it cannot be cultured on routine media. This opportunistic pathogen cannot be cultured on routine media. On silver staining, silver staining में हमें मिल जाता है. Its cyst walls, they stand out prominently as crushed, cup-shaped or crescentic structures in advanced immunosuppressed states. So all 7. A sewage worker presented with abdominal pain, jaundice, conjunctival injection, and blood in urine for past 5 days. Sewage worker, so it is an occupational related disease. Sewage worker presented with abdominal pain. उसको क्या हुआ? Abdominal pain, jaundice, मतलब आंखें येलो हुआ है, conjunctival injection and blood in the urine. अच्छा, urine में blood है for the past 5 days. 5 दिन का history है. Which of the following is the investigation of choice? Investigation of choice. choice में क्या पहले ऑर्गेनिज्म क्या है वो देखना है हमें. तो मे बी वेल्स डिसीज भी हो सकता है. तो वेल फेलिक्स रिएक्शन, पॉल बनेल टेस्ट, माइक्रोस्कोपिक अग्लूटिनेशन टेस्ट, वाइडल टेस्ट. सो दीज आर द 4 ऑप्शंस है. हिंट देख लेंगे हम. आइडेंटिफाई द स्टैंडर्ड डायग्नोस्टिक सीरोलॉजिकल अग्लूटिनेशन टेस्ट टेलर टू डिटेक्ट एंटीबॉडीज अगेंस्ट पैथोजेनिक स्पाइरल पायरोसाइट्स. हाँ, स्पाइरल पायरोसाइट्स shed in rodent is MAT, microscopic agglutination test. So the presentation highlights Wales disease. Okay, this is a Wales disease. It is the icterohemorrhagic form of leptospirosis. Ictero means that is jaundice. Jaundice, icterohemorrhagic मतलब bleeding हो रहा है. Hemorrhagic form of leptospirosis. So common in occupational sewage work. The microscopic agglutination test, MAT test, it is a standard reference serological investigation. So this is the answer. Next question. 8th one, which of the following laboratory test is used to diagnose rotavirus diarrhea? Rotavirus diarrhea के लिए हमें कौन सा टेस्ट करना है? Options are A, antigen detection in blood, B, antigen detection in stool sample, light microscopy of stool specimen, D, antibody detection in serum. Hint is the virus replicates aggressively inside the epithelial lining of the small intestine. Virus है, it is aggressively replicating inside the small intestine epithelial lining, is shed into the lumen in very high titers. So lumen में चला जाता है. तो रोटावायरल के हमें कौन सा टेस्ट करेंगे? एंटीजन डिटेक्शन इन ब्लड, ब्लड में कुछ हमें दिखाई नहीं देता. एंटीजन डिटेक्शन इन द स्टूल सैंपल, स्टूल सैंपल में हमें एंटीजन डिटेक्ट करना है. आंसर इज रोटावायरस replicates massively within the mature enterocytes at the villi tips. Villi tips में होता है. Shedding up to 10 billion viral particles per milliliter of feces. So making direct fecal antigen detection via enzyme immunoassay highly efficient. So this is the answer. Next question. A boy presented with fever and chills. Okay, fever and chills. Rapid test was positive for specific antigen HRP2. Which of the following species of Plasmodium is most likely causative agent? So causative agent क्या है इसमें? Options are Plasmodium malariae, Plasmodium ovale, Plasmodium falciparum. Answer is Plasmodium falciparum. Histidine-rich protein HRP2. Histidine-rich protein HRP2. It is a specialized water-soluble antigen. क्या है ये? Water-soluble antigen है. expressed and secreted into bloodstream uniquely by asexual intra-erythrocytic stages. Erythrocyte मतलब RBC intra-erythrocyte stages of this specific species. Okay, तो मलेरिया के बारे में क्वेश्चन स्टॉप. Okay, next. A child was brought with complaints of high fever, multiple seizures, headache, and neck rigidity. CSF analysis shows low glucose, high protein, and many polymorphs. The CSF culture showed pleomorphic gram-negative bacilli. What is the true about the causative organism? What is true about the causative organism? Okay, so the options are A. It produces non-lactose fermenting colonies in McConey agar. Next options. It exhibits alpha hemolysis on sheep blood agar. Exhibits satellitism around Staph aureus colonies. It is bacitracin sensitive. Answer is the causative organism. It is H. influenza. Haemophilus influenza. It is a pleomorphic gram-negative rod that requires factor X, that is hemin, and factor 5, NED. When grown near Staph aureus, it displays satellitism because the staph streak, it breaks open blood cells to release factor 5. So these are the 10 questions. So we will revise it again later. So these are the 10 questions. We will revise it again later. Okay. So let us meet in the next video. Thank you. All the best for the NEET PG exams.